Hello, thank you for joining us today. Kayla, Alana, Katie, and I will be talking about alternative augmentative communication in the intensive care unit. Before we begin, I want you to imagine that you wake up in the ICU and are surrounded by unfamiliar people and loud machines, but are unable to ask anyone what happened, where you are, or any other questions that might be racing through your mind. What is AAC? Augmentative and alternative communication is an umbrella term including the communication methods or assistive technology used to enhance or replace speech or written language. AAC is the use of any equipment, tool, or strategy to improve functional daily living in individuals with disabilities or limitations.
So then when talking about the different patients within the ICU who may benefit from AAC, honestly, any patient who is unable to speak or clearly communicate could benefit from the use of AAC. However, it is important to be mindful of the client's cognitive state when deciding to use AAC with your patients. This is because deficits in cognition can make it difficult for the client to understand the purpose and use of AAC. But to name a few patients who may benefit, we're looking at patients with facial injuries, head injuries, spinal cord injuries, stroke victims, patients who are intubated, and patients with tracheostomies.
So, say you have a patient that Alana just named. So, you don't stop there. We've got a wide range of AAC device options, ranging from low tech all the way through high tech. And each patient is going to be different. So, today we're going to talk about a low tech option, which would be a communication board, as well as a high tech option of computerized AAC. So the first is the lower tech, which is communication boards. These are made up of icons and pictures, and they can be individualized to your patient, or they could be general that you could use with almost anyone. So as you can see, here's an example right here on the right, and this would be a more generalized example. It has I am statements, which would be like, I am feeling sick, I am dizzy, I am angry, things like that. Then you go into the I want section. I want water. I want to lay down, where they can request things. Then I want to see, they could request an individual, like I want to see family, I want to see a nurse. And then into more basic below that, it's got a red thumbs down for no, and a green thumbs up for yes, and a stop sign if they want to indicate stop. Then if their request is not on this general board, there is a keyboard where they could spell out what they are requesting. So the pros for the communication boards is that they're increased efficiency and speed. It decreases frustration when trying to communicate wants and needs. It allows them to express those needs much faster, and it's a low cost option compared to a computerized device. Speaking of the computerized devices, these are databases of pre-stored phrases and pictorials. So while the communication board was just icons and pictures, this is a whole database that you can customize to your individual patient. Most of these do have a speech synthesizer where they tap out their entire phrase or sentence, and then it will do kind of a talk to text, which we might be more familiar with, to give that verbal output. Even higher tech devices may have an infrared eye blinker detector. So they can just look at the icon that they want to select, and it will read that eye gaze and give the verbal output. Those are definitely on the higher tech end of the spectrum, though. If it's an AAC device that was made for AAC and that was it, they might have touch buttons of all the icons. If it is a device such as an iPad or another tablet, it might be just a touch sensitive screen. All of these are accessible options for computerized AAC devices. This example that I have on the right with the top and bottom is an example of ICU Talk Communication Computer, which is a program that was developed by Macaulay and colleagues. This is a web system of general questions, interests, family and visitors, just chit chat, as well as wants and needs and a few others. So they could select one from the web, and then it would give some pre-designed phrases specific to ICU patients. So this is a computerized AAC device that is specific to the ICU, but that doesn't necessarily mean it's the one you would have to buy. Pros for the computerized AAC devices is that they are more individualized than the lower tech communication boards. However, they do take more time to learn, especially the eye gaze devices. That's going to be a lot of training, and they are more expensive than the lower tech options.
So now we are going to discuss why we would want to use these different AAC devices that Katie just discussed. Using AAC will allow the patient to report their symptoms, direct their care, and also allow them to ask questions. The communication system helps improve the quality of their hospital stay and can also help keep nonverbal patients safe. When patients are able to express their end-of-life wishes, family members are able to reconcile with the end-of-life decisions. So when it comes to that time when they have to make those difficult choices or decisions, this is allowing the person to express what they want and take that burden off of the family. And then it was also noted that the healthcare professionals have also expressed a decrease in moral distress and they experience when they cannot communicate with their patient. So this moral distress could be a decrease in anger, hopelessness, and frustration when they're not able to communicate with their patient and get their wants and needs.
All right, so now that we've talked about the different types of AAC and why you may use AAC within the ICU, I'm going to discuss 5 tips for using AAC with your patients. The first tip, and one of the most important tips in my opinion, is that when using AAC, you need to give your patients plenty of time to process and respond to what you're saying. As you know, the ICU can be a loud and overwhelming environment, not to mention your patient is likely under a lot of stress during this time. When using AAC, you need to first make sure the patient understands what you're asking and give them plenty of time to not only think about their response, but also to think how to communicate this with you using the AAC. As I mentioned, there's a lot going on in this time, and just because they don't respond right away does not mean that they're not trying to figure out how to respond to what you're asking or saying, or even just to communicate in general. This brings me to tip number 2. Don't overload the patient. What I mean by this is ask one question at a time, and like with tip 1, give the patient plenty of time to answer before moving on to the next. If you're asking multiple questions at a time or asking questions and making comments at the same time, it's likely going to be difficult for the patient to respond. Not to mention, if you ask 2 questions and you only get 1 response, depending on the questions, it could be difficult to know which question the patient was attempting to answer. It's also important to be mindful on what you're asking the patient and whether it's something they can easily answer or if it's something that requires them to elaborate on. So before asking questions, take the time to ask yourself, how can I simplify this question and how can I simplify it to get a simpler answer? Tip number 3 is then find what is most beneficial for your patient. As we discussed, there are a lot of options when deciding to use AAC with your patients, and you need to keep in mind that all patients are different and what may work with one may not fit another person's needs. And some things to consider when deciding which device to use with your patient is their age, their level of cognitive functioning, what they need out of the device. And so, for example, some patients may show more difficulties navigating higher tech options, whereas other patients may prefer a higher tech option. Tip number 4 then is low tech does not mean low quality. I know after hearing Katie discuss the different AAC options, the high tech options may seem like the best quality options there are, especially with the increase we've seen in technology. However, low tech does not mean low quality, and sometimes simpler is honestly better. As I mentioned, high tech options may be too complex for some patients anyways. Not to mention, they're more expensive and may not easily be available. In your clinic or your ICU, you may only have a couple different high tech devices, but you may have 5 different patients who could benefit from AAC. So in that case, low-tech options still provide patients with an efficient way to answer basic questions express their needs, wants, how they're feeling. I mean, think back to the communication board that Katie shown. A communication board is a low-tech option that's easily attainable. It's easy to take with you. You can customize it for your client or patient, and it's less complex to navigate and explain. Which brings me to my last tip, which is you also need to know how to use the device. When making the decision to use AAC with your patients, it's important to have an understanding of how to use and navigate the device so you can teach your patient how to use it as well. When introducing AAC to the patient, you're not only going to have to explain to them what the AAC is and why you're giving it to them, but you're also going to have to show them how it's used, how to navigate the different responses. So if you have a poor understanding of how the system is used, then ultimately it's going to be difficult for your patient to learn how to use it as well.
As we begin to wrap up our presentation, we want to show this example of how AAC can be used in the ICU. The company Outcome Tech worked closely with SLPs and nurses at St. Joe's Hospital to create this AAC device for the ICU.
Welcome to Alexicom Tech. Our mission is to provide a way for people to communicate and to be understood. We're so excited to release our healthcare apps. We created an ER app as well as an ICU app. We created these page sets based off of the input we received from speech therapists and nurses working in that environment. So those of you that are familiar with our Elements apps, this list includes all the pages that are in the page set. The page at the top is the main home page. So when you click on it, you'll see the home page options. Anything with a blue arrow on the bottom right links to another page.
Concerns and questions.
Click it, you'll have some more options. So like I said, when we worked with the nurses
Personal.
and the speech therapists, this was the vocabulary
Environment.
that they saw parents or patients wanting to use most. You can use the keyboard if the patient wants to tell you something and maybe they just know the letter that it starts with.
G.
If the patient wants to spell out what they're trying to say, they can also hit the text box at the top to pull up the keyboard. So pretty easy, and hopefully this helps provide a voice to somebody that is in the hospital environment. Please join our mission and provide people with a voice.
So as we are wrapping up, while we were conducting our research for this in-service, we came across some specific quotes from nurses. We found the quotes from nurses that have expressed how AAC has affected not only their patients' lives, but also their own lives. Where we found these quotes were from a research study conducted at 2 ICU centers in Botswana, who primarily had individuals that were mechanically ventilated in their ICUs. These nurses went through workshops to learn about AAC devices and how to implement them in their patients' rooms and with their patients. So here are some direct quotes from nurses that have participated in this workshop from this specific research study. The ICU is a very challenging environment. The patients we receive in the ICUs are critical, and saving life is a paramount, and hence we forget to communicate. However, after this workshop, we will all communicate. I have realized that giving up while the patient attempted to say something was a mistake. I did not provide full care to my patient. During our orientation, emphasis on communication was not done. I believe they took for granted that all nurses can communicate with ventilated patients without difficulties. And then the last one, I carried out procedures silently or ignored patients when I could not understand them. Now I appreciate that my care was incomplete. I strongly believe that emphasis on communicating with ventilated patients should be extended to new nurses. So as you can see, just from these 4 quotes that we provided, how tremendously it has affected nurses and also the patients, and how nurses are hoping that this is implemented with new nurses.
Now that we have taught you about using AAC in the ICU, we want to go back to the scenario we discussed at the beginning. When you wake up in the ICU and have no idea what is going on or how to communicate. Now, we challenge you to think how grateful you would be to have an AAC option provided to you, allowing you to have the chance to communicate and be a part of your care plan. Here are the references that we used for this presentation. Thanks for watching.